We are here because we want to talk to you guys about something that's near and dear to us, and the reason that Elevate exists on a medical standpoint. We're trying to create the best team of clinicians that can work with the best team of coaches, nutritionists, body workers, how to find a good clinician. So a couple of topics, or a couple of key points for us we'll go over. Things to look for, things to expect of your clinician, and then further who they communicate and how they communicate with those people.
Yeah, it's especially hard because if you want to go to a good restaurant, you have the food tastes good, and then you got things like Google and Yelp to give you reviews of a sense of like, is this worth spending my money on versus not? But when you're not in the medical field, it can be really hard to say, well, what does make the clinical experience good? Mm-hmm. Because there's certain qualities that your physician or anyone you work with should have and possess that separates them above the rest. Because just like restaurants, not every clinician's good. Just like not every restaurant's good. There's some that are great, there's some that are bad. We're going to help you figure out what those qualities are that are going to get you to those 5-star clinical experiences. All right.
And it doesn't have to be just with a chiro or a PT or a physical medicine specialist. Looking at this from a dentist perspective, or from a dermatologist, or from a neurologist, I think these can definitely have you can have a application to all facets of being a physician. So
sure.
When we go through this stuff, don't think it's only speaking towards our professions that we're talking about in front of you, the PT and chiro. It's kind of well-rounded towards just good clinicians, good physicians that do the right things. So first off, pretty important. We feel like we're pretty good guys most of the time. Zach's okay. I'm exceptional. It is what it is. But do you like them? Do you like this person? If you walk into a room and you get this vibe of, I think I could probably go hang out with them, outside of a clinical setting, that's probably a good sign that you're going to be able to open up to them. You're going to be able to give them as much information as possible. You actually care to conversate with them. That's probably one of the biggest things with me when I'm taking an intake of a patient. I try to make them feel as comfortable, as open as I possibly can, because that for me gets them to, one, trust me, and then I get a really thorough history. If you feel kind of, I don't know if I really want to tell this doc this fact about me. That sucks, because for me it takes one little aspect of their history out of the equation, and sometimes that's really crucial for us too. Mm-hmm. I don't know if you've had experience there.
Have I got a story for you? So I worked with this guy, and he was in his 60s, but he was very muscular, like trained, exercised his whole life, and was dealing with some pretty bad back trouble to the point where he was going to the ER quite a few times. And I worked with him a couple times. We didn't really get many changes. And I just how you ask those questions that are red flags. It's like, are you having any changes, bowel and bladder? Do you have any loss of sensation, all that? And it took the second or third time that he told me, I was the only person he ever told that he was actually losing bladder function. And that's a significant thing.
Huge.
And he's like, well, I felt embarrassed telling anyone else because I'm a strong dude. I shouldn't feel this way. And so I sent him, I'm like, look, you got to tell that to the people at the ER, immediate referral, get out of here. So you can, if you don't like or you don't trust the person you're working with, that can have a negative impact on maybe doing what is best for you. 1. 2, you may not be able to accept treatment as effectively. And I want you to think about this. Say you're around someone who's awkward, or you just get like a bad vibe from them. And think about how you feel within your body and how your demeanor changes. Maybe, if you're around someone who you're a little scared of, like when Kyle's around me because I'm more muscular than him, your heart rate starts to kick in. You might be breathing a little bit more faster.
Happens every day.
Yeah, every day. So things like that. And especially if we're talking about pain, like if you're working with one of us, those are the responses that we see when people are hurting or your blood pressure's higher. So you might actually not get the response that you could, whereas if you had someone who you trusted and you resonated with. So it goes beyond just, do I like this person? Like there's actual legitimate things that can help your treatment. Another thing to think about is the placebo effect with someone who you like versus don't like. So people think the placebo effect is that you're tricking me into getting better. No, what we mean by that is there's non-specific effects to the treatment at play that can lead to enhancements of outcome. Just like, if your partner gives you a massage, and generally that feels better, it seems like, than if you go to a massage therapist sometimes. And the reason why that is because there's non-specific effects that you get with the interaction with that person. Exactly, that lead to more favorable changes.
Yeah, I mean that's 100%. Because what Zach and I do is you do have to put your hands on a patient, or sometimes you don't. But if you're in close proximity with that person and you just get the heebie-jeebies, it's going to be really hard to work with that patient to feel like that we can move and we can make a positive impact on them. When I'm working on someone and I'm doing manual therapies, meaning adjustings, doing soft tissue working and stuff, I want them to feel loose. I want them to let me work with them. And if they're constantly kind of battling and fighting me, it doesn't help me. It doesn't help with applying the actual treatment. But most of the time, if I conversate with them and I get them to kind of loosen up some, makes it for a better treatment, and makes them accept that stuff a little bit more. So topic first, make sure that if you walk into the room and your first interaction makes you feel good about that, that's one checked off the box. You have a good feeling about that interaction. That's probably a good first sign that that's a potentially good candidate for you. You have anything else on that one?
Yeah. And
I saw I was itching. You had one?
I do. I had because you said something. I was like, oh yeah, we got to say this. Sometimes too, you're like, you could have a good person, but you might just not jive with them. And I've had that with me, where it's just like, I was myself, but it's just like I could tell that I wasn't the type of personality that they needed. And so I actually referred that patient to someone else, and they had a significantly better experience. And so if the person you're working with kind of hopefully senses that and they don't have an ego about it, like don't be afraid to ask to go to someone else, and for that reason alone. So if someone doesn't like me here, Kyle, which, I couldn't imagine, but it does happen, I would definitely refer him to my boy over here, or my boy in the back, Dr. Wood.
So that's checkbox number one. Make sure you like them. Make sure you feel like you're able to accept treatment from them. Step number one. And then next is making sure that you don't end up in a position where time becomes very limited and it feels rushed. We get this a ton because of the facility that we work in. Is we try to give everyone a very big amount of time so we can actually fully treat the human body, because the human body is extremely complex. We have a lot of questions. We're constantly trying to figure out what's the next progression for this patient, and that does take time. If you're given 3 minutes with a physician and you think that you can barf out all of the information needed and it can be deciphered and the physician can treat you, it's sorely mistaken most of the time. It's more of a temporary fix, maybe, even if that, but it's not going to be individualized to you. Time is very, very important. So when you're asking around, make sure that they're going to give you an average amount of time, give you the average that doctor sees a patient, and we definitely think that it's got to be around 30 minutes on follow-up, and there should be a very significant intake where you're spending close to 60 minutes with a patient or more, depending on the case and the severity of the case. But there's a lot of stuff that needs to be discussed. And during that treatment time, it should be devoted to you and you only. It should be a one-on-one type situation, because it takes a lot to treat a human body, and there's a lot that goes into it.
Yeah, for sure. And especially too, if you're not having much time, it just doesn't give the clinician time to figure out how to best help you. Yeah. So the more time you can get with that person, the better. And also, two, if you are working directly with the clinician as opposed to working with a tech or an aide or an assistant, that's generally going to be better as well, because anytime there's a handoff in care, there's going to be a drop-off in terms of what's going on unless you're handing off to another discipline.
Yep.
But if I'm working with someone and then I hand off to someone who's underneath me or someone different who's in my PT clinic, you might not get as good quality of care as opposed to if I was making the decisions alone. Yeah. And I don't know how it is in Chiro. I think the problems y'all have are a little bit different than us, but as a PT, the thing that I see a lot that's problematic in our field is you'll have one clinician either working with several people at once, or one clinician gets a short period of time with you, and then they pass you off to a tech. And a lot of times the tech is also managing several people. And it's just, when you can't get individualized care, the amount of success that you have is less. And the unfortunate thing is, if you're trying to go the insurance route with this, that's more often than not the case, especially in larger cities.
Yeah, it turns into a time and a numbers game as opposed to a clinician and the patient in front of you. That's very important, that you are showing up for care for you, and it's not you, Sally, Joe, Bob, and Tim all getting in that same hour of care. So definitely make sure that time with the clinician is sufficient and you feel cared for. You don't turn into a number, but consistency of care can actually get you to progress. If it's you see this person, a clinician for 3 minutes, and they say, "Oh yeah, you're going to be working with this tech," and they set you up on a machine, and you've done the same thing that you've done prior, you're probably going to get the same results if it's not progressed in a good manner. But that takes a thought process, and not to knock any techs or aides or anything like that out there, because there's a lot of really smart ones and a lot of very talented people out there. But there's a reason that a doc goes to school for certain years and gets taught a lot of things on how to progress a patient and stuff, and that's what you should be paying for, and you should be showing up for, is progression, consistency of care, not seeing multiple different body workers or multiple different physicians for the same type of care. Yeah. So that leads us right into another point, is treatment does need to be dynamic. It needs to be something that is progressive. It changes from time to time. You work on something, you accomplish a goal. Once that goal is accomplished, then you see a change or a progression to those types of treatments. So when you see treatment that is not dynamic, it's 8 weeks of the same stretch or the same movement or the same progression of exercises, that can unmotivate a patient, and it can create bad changes in the body, because you're sacrificing 8 weeks of potential progression at that point.
Yeah, especially when we're talking about the early phases of rehab. If the goal is to improve pain and movement, you can, in theory, your body should be able to change and adapt pretty quickly to those things. So it's not uncommon for the people who I work with to change up their moves every week to 2 weeks. And it should all progress and go above and beyond that. The only time where you might not see as much changes over a short period of time is if you're over on the other side where you're doing training. So if you're working with a clinician who's trying to get more, you're less pain, but you're more like, I need to get stronger and better conditioning, that's a time where we're going to spend a little bit more time being redundant with stuff. But that should not be the case in rehab at all.
Absolutely.
And then the other thing too is, if you're not doing any exercise, while manual therapy and hands-on work can be useful and it can be essential a lot of times, your body isn't always learning from that experience. a lot of times we use manual therapy either as a way to get you feeling better so then you can move, so then your body changes the patterns that it's using that are not desirable, or it's a way to, if you can't get the movement concept that we're trying to teach you, it's a way to take a step below that to teach you the concept at a more lower level or a more intimate level.
Yeah, that's a huge point right there. Making sure that that's hammered home with each patient is, the education aspect of after a treatment, now we need to experience or strategize different movements. Huge.
And it doesn't have to be a lot. Like another thing too, and this is what we run into at PT, is I've had patients where they have 6 pages of exercises to do as their home program. Ideally, you might only need 1 to 3 moves in the early phases of rehab, and then as you go later on, then it's going to be more like a legitimate training program. But the moves should be as specific as can be to what you need, as opposed to a general catch-all protocol.
Yeah, that's the spectrum, if you will, of rehab and training. You start getting more and more, like you said, movements and stresses on the body as you get closer to a performance or a training setting. At some point, that might turn into Zach saying, you know what, you are actually to a point where pain isn't so much of a problem anymore. And when we talked about being able to hand off to someone, this is when a handoff is actually really useful. We hand off to a coach, or we hand off to someone that's going to start attacking a different type of problem, not just a pain and dysfunction, but now we're looking at endurance and strengthening aspects where we're actually lifting a decent amount of weight and getting into more durability stuff. Mm-hmm. So definitely dynamic treatment. That, again, it kind of leads right into the next point, which is awesome. What happens after treatment? We just spoke about it. Is there a plan after treatment? So I guess this probably wouldn't be, maybe in some fields. Say, a dentist, they worked on you. What's the transition back into, eating, I guess? Would that be the next transition? But in our field, we definitely have a need for, once we get a patient in a place where they're not in so much pain, we need to have a plan for actively getting them into their goals. When we take a history, we always try to find, hey, what are your goals? What is it that you're currently not doing that you want to be able to do? Once we attack pain, if pain goes away and function gets a little bit higher, that's not everything. That doesn't get them to a point where they're free to go. Sometimes they'll feel good enough and they kind of do their own thing, but most of the time we want to give them ideas on how to make this long-standing, a little bit less risk of pain. So that's when we're looking at what happens next. We can start looking at more of a tailored program that takes their rehab and keeps on progressing to that performance aspect.
Yeah, for sure. Because really, with rehab, all that we're doing is we're setting you up to be in a position to really make the lifestyle changes you need so you don't have to see us again. Because you can you can come to one of us, get the treatment you need, get the exercises you need to feel good, but what's really going to help you over the long term is making sure you increase your physical activity levels, making sure you're eating in a manner that's healthy for you, making sure you're taking care of sleep, all the things you need to be a healthy person. And that might seem daunting, but a good clinician is going to be able to point you in the right direction to what's going to be the most impactful thing now. And a lot of times for us, since our bias is more movement oriented, is getting you over into a gym, whether it's with us or whether it's training on your own, anything like that. And one thing too, we probably didn't talk about this, but in this regard, if we can't get you better or a clinician can't get you better, they should also have a good triage program in place. So we have people who we like that we can send you to make sure you are taken care of, because sometimes you might have something structural that is causing your pain, and then we can refer you to that. Or maybe you have something that is not necessarily structural, but a contributing factor that might be leading you to having reduced movement in specific areas or pain. And one example that I have, and of course this is my bias, but like if someone has an airway issue, like if you have sleep apnea or you can't breathe through your nose and there's something structurally impacting that. That actually could be the best referral for you to help you with both your pain and your performance.
Yeah, I mean, having that network, and we have our preferred people that we use, and we have lists of people, and then even within our own walls, we've had cross referrals within Zach to me to Zach, and we'll continue to do that stuff if we have those types of needs for the patient. If we think that it needs a second opinion. That's what we use our other clinicians and our other minds for. We got great minds here, so we might as well use them because we know our team is some of the best in the valley. So again, that's our bias. We want to have a good team to either refer to, or within our walls we refer to another clinician. That's a good point. Because there's been plenty of times that we've needed to refer out for imaging, or like you said, structural pathology or structural irritations. And if it's care that just keeps on going and there's no results, that might be one, damaging to the patient's psychology, that they're never going to get better, and two, it hurts the pocketbook getting treated and not seeing any results. So that's a good point. So looking at the last point, we pride ourselves on having a lot of different tools, constantly trying to educate ourselves, having a lot of different approaches. So there's passive and there's active tools that we have. We tape, we cup, we scrape, we adjust, we mobilize.
Stick needles in.
We dry needle. These are all tools that we use for, again, creating that environment that a patient feels different when they move. We don't have to be married to any of those, though. So if someone's known for this is the only thing they do really, really well, they might do that really well, but if they don't have any other tools, it might limit the amount of people that they can help. So the more tools that this potential physician has, the better the more people they can actually serve. Because I've had plenty of people in my office, they're like, don't touch my neck if you think you're going to adjust my neck. Don't even think about it. And that's fine. If they're that apprehensive, maybe later on down the road, they start getting a little bit of that rapport. They start liking me better and they start trusting me more. Maybe that becomes an option. But on the front end, I don't have to adjust someone. If I can use other tools, any of the other cupping, scraping, soft tissue work, send them over for needling, any of that kind of stuff, I can still work with that patient and still try to give them the best experience possible, but it doesn't have to be that one tool. And I don't know, I'm sure you've had, similar people say that about needles.
Yeah, for sure. I mean,
one
of the number one times you don't needle someone is if they have a needle phobia. So it's like, and that's okay. I think it's important to have a wide variety of ways to potentially be treated, but what's going to be most important is if you have someone like that who has a vast skill set, they're going to know what to give you, because
they'll listen.
Yeah, they'll listen. And if Kyle might not like needles, but he also might not need needles, and he might need some other treatment to be able to get him to feel better. And the same thing is true with you. Is like the tools are important to have, but it's not that needling is going to be your fix, or adjustments are going to be your fix, or exercise, breathing exercises that I would give are going to be your fix. It's going to be someone who has a vast knowledge of a lot of different things, knowing what's going to be the best treatment plan that's individualized to your needs. And that can be a wide variety of things. And it's not uncommon for us to have two people who have the same complaint get vastly different treatments to get there, because their individual needs are going to be different, and that's what you need to advocate for yourself.
Yeah, and still, having within session, you can use a bunch of those different tools too. It's not, you can scrape, you can cup, you can tape, you can needle, you can adjust, you can do all that kind of stuff, and that makes for a really good experience if all that stuff is accepted well, or you start working on an area and you see kind of some hesitation or resistance. you need to be able to switch to something else pretty quickly and see if you can get another positive step in the right direction.
Sure.
So all patients are going to be different, like you said, with how they accept treatment. They can present the exact same way, but you have to completely change up the skill set that you're going to be applying to them.
Yeah, and as a patient, don't be afraid to say something hurts or you're uncomfortable with that, and say no, because you are the biggest advocate for your care. We, as good as we feel we are, we don't know what you're feeling inside your body. So the more feedback you can give us or the person you're working with, the better you're going to be served. Like I've had so many people where a movement looks good and like, okay, how'd that feel? Well, it hurt the last 3 sets. And I feel bad because it's like, I wish you would have told me that because I would have changed something about it so that wasn't the case. So don't hesitate to give the person you're working with feedback, because that's really the only way they're going to know how to manipulate things in a manner that is more helpful to you.
And maybe that's your first criteria for working with them. Do you feel like you can give them critiques? Do you feel like you can give them constructive criticism towards treatment? That is needed. It definitely is needed, because we're in our own body. We can't feel what our patients are, like what you were saying. You can't feel what they're feeling. We're only getting information as we apply treatments, or we're seeing how they move. If they're moving really poorly, we probably think, yeah, it's probably maybe a little bit painful with some of those movements. But so recap: do you like them? Can they spend a decent amount of time with you? Is it going to be individualized? Is that treatment going to change with you during treatment? Does it progress? Does it constantly have a need for new stresses, new progressions? Is there a bridge towards what is going to happen next? Is there going to be a sound referral if your treatment isn't working? Those types of things are very important. And how big is that tool belt on that physician? Is it big? Is it well versed? Is it well used? And are they humble enough to change their approach if it's needed? Those are definitely some of the big things that we wanted to hammer home. Check those boxes off with anybody that you're going to be working with, and you should have a pretty dang good experience. Again, if you guys have any questions, we're always here for your questions on either Instagram, or you can reach out to us, 702-558-2151.
Yep.
Or you can reach out to us on our website and inquire about anything on there. See you guys.
Thank you. Take care.